the appropriations process. And we've got quite a number that have signed up. So what we're going to try to do in respect of everybody's time, we'll recognize you and let you come and speak to us, and we would ask that you would limit your remarks to no more than 5 minutes. Brevity would be appreciated, and then if you would like to leave some printed testimony or comments with us, we'll be happy to take those and have that attached as part of our meetings. I'm going to begin just by the way that we have those who signed up. John Howell from Georgia Healthcare Association is going to be first, and then David Tatum will be coming up next. So, John, go ahead.
Chairman, John Howell, Georgia Healthcare Association, representing 95% of all the skilled nursing facilities across the state, 100% of the source care management agencies, and a growing number of assisted living. It's a pleasure to be before the committee again, and by design I'll make my remarks as quick as I can. I rise to support the governor's recommendation for a 2012 cost report update for nursing home providers, and also to say a word of support for the 5% increase for the home and community-based services, including CCSP and SOURCE. One thing I would like to raise for the committee's consideration, there's a little bit of uncertainty about that language on the home and community-based side, whether or not that included the source care managers, which of course are those individuals that are in charge of case managing those individuals and actually keeping them out of the institutional setting. So we would ask the committee's consideration to have those included in that 5% increase. So with that, Mr. Chair, I think I'll try to get on the committee's good side by wrapping up quickly.
Great. Well, you didn't use your 5 minutes, so we'll see if we've got a question or two for you. Anybody on the committee have a question? You did a good job. Thank you, John. Next, we'll hear from David Tatum with Children's Hospital, and Sheila Hubberstone will be next after that. Dave?
Thank you, Mr. Chairman. I rise in support of the governor's recommendation to add $2.4 million to the state health benefit plan to cover autism services in the 2015 budget. Now, earlier today, I provided y'all's offices with a handout that talks about the incidence of autism and the cost effectiveness. If you do not have it, I brought some more with me. You got it? I'm sorry? You need some. Thanks, John. If you take a look at it briefly, the first page talks about the incidence of autism. It's pretty high. It's 1 in 88 children in the United States, and even a little bit higher in metro Atlanta. It's higher incidence than congenital heart defects, childhood cancer, juvenile diabetes, and cystic fibrosis. It's real. Children's has operated the Marcus Autism Center in Atlanta since 2008. We took it over and have run it, and we see about 5,700 kids a year. I'd really like to direct you to the obverse side, the reverse side of the one-pager, where it talks about the benefits of early intervention, that if children are diagnosed with autism early and the right type of treatments available, it can reduce the long-term cost of their care by 2/3. And as they grow up, a lot of those environments where they're going to receive that care are going to be funded by the state. In education in particular, in Georgia, it's been documented that if you can diagnose a kid early, it can cost as much as 2/3 less to educate that child per year than have it untreated. And there's some technology out at the Marcus Autism Center I want to mention briefly. A couple of years ago, we recruited Dr. Ami Klin from Yale and his 12-person research staff, and this has been written up in the scientific journals, vetted, and it was in Nature magazine a couple of months ago. We have some technology that puts a 3-month-old, 4-month-old infant into something like a car seat that looks at videos of social interactions. And there's an eye tracking monitor that tracks those movements. And if the eyes of the child focus on the eyes of the people in the video, then there's less of a chance they'll have something on the autism spectrum disorder. If the eyes track the objects, not the other person's eyes, it's more likely. And this has been fully vetted. It's going through FDA approval. And we can diagnose a kid as young as 6 months of age. And if we can do that, Dr. Klin tells you we have a better opportunity of doing something as simple as teaching that child to talk. And if you can teach that child to talk, They're going to do better in school, have a lower education cost, and have a better quality of life. So with that being said, we endorse the governor recommending this coverage in the state health benefit plan, and I'll be happy to entertain any questions.
Thank you. I believe we have a question. Representative Gardner, you have a question.
Thank you very much, Mr. Chairman, and thank you to the Marcus Autism Centers and to CHOA for the remarkable work you're doing on diagnosing autism. As you probably already know, my concern is beyond the diagnosis. Where do these children get treatment?
This proposal does not specify what the treatment package would be. My understanding from talking to the Office of Planning and Budgets, that would have to be worked out with the department should this be approved, because it's effective January 1 of 2015 and would be for the first 6 months of calendar 2015. We have recommended to them that they use the advanced behavioral therapies, which we currently use at the Marcus Center, and other people use it around the state. It's scientifically proven, it's evidence-based, it's effective, and we're hoping that if this coverage occurs, more providers will start offering this. We know that we can't see every kid in Georgia. We're not set up to see that. We see 5,700 kids a year. We've got a waiting list right now. And one of the things we'd like to see are more resources in local communities, and we think this will help.
So you work closely with the Emory Autism Center?
We do work with the Emory Autism Center. As a matter of fact, Dr. Clynn's on the Emory faculty.
I guess the other issue is really treatment for children with other mental health disorders, behavioral health problems beyond autism, and I would like to publicly encourage you to take a look at the need for children and adolescent behavioral health treatment.
Yes, ma'am.
Particularly in the CHOA system, which is a remarkable system of care.
I understand you've certainly privately encouraged me to do that for a long time. It is not a core service that we provide for child and adolescent psychiatric care, but there's a tremendous need in Georgia, and we certainly acknowledge that.
Okay, that's all the questions we have.
Thank you
very much. Sheila Huberstone, and next after Sheila be Dave Zillis.
Good afternoon. I rise today on behalf of the Alzheimer's Association Georgia chapter. As many of you know, Alzheimer's disease is the 6th leading cause of death, and that Alzheimer's-related deaths have gone up by 68% from 2000 to 2010, while all other leading causes of death have decreased. Alzheimer's is, in fact, the only leading cause of death in the top 10 that there is currently no way to prevent, treat, cure, or even slow down the disease. In Georgia, we have approximately 200,000 folks living with Alzheimer's and about 500,000 caregivers. I'm sure there's a lot of us in the room that have been touched by Alzheimer's. With the baby boomers aging and what we call the silver tsunami, these numbers are only expected to rise. Experts say by 2030, 1 in 5 Americans will be over age 65. Unfortunately, because of the nature of Alzheimer's, it makes them extraordinarily likely to experience some version of exploitation, abuse, and neglect. For that reason, I want to rise in support of the increased funding for emergency placement, as well as the adult protective services pieces. We did a great job last year passing House Bill 78, which provided some great tools for enforcement to protect these individuals. Now we're going to need the staffing to make sure we can investigate these claims of abuse, and that we have emergency placement so that when we find someone in a dangerous position, either in their home or in a personal care home or in another a bed that is unlicensed that should be licensed, we need a place to put these individuals. Oftentimes we can't find family for a little bit, and so we need emergency placement to place these individuals and adequate APS staff in order to investigate these claims. Thank you.
Thank you. Any questions? Don't see any. Thank you very much. Excuse me.
Just one bit. What kind of statistics are you seeing now on the increase, or is there a rise in autism? Are you seeing an increase?
Alzheimer's?
I mean, Alzheimer's. Right.
That's all right. We followed each other, so it makes it a little challenging today.
Right.
You know, I think I worked with quite a few folks over the summer on the Alzheimer's and related dementia state plan. And we have a couple of pieces of legislation that are coming. One's going to create an Alzheimer's registry because we really don't have any mechanism right now to truly track the numbers in Georgia. What we're also doing is beginning to have a spot on the death certificate where we identify Alzheimer's as a cause of death. My mom, for example, died 2 years ago of Alzheimer's, but on the death certificate it doesn't say Alzheimer's, even though that's what she died from. It says heart failure. Well, it was heart failure because of the Alzheimer's. Right. And so I think once we have some of this legislation, we'll have a much better idea, and that's the idea of the state plan, is to bring in that information so that we are able to plan ahead of time and not get hit on the side of the face with what we know is coming.
Right. Well, I've been practicing dentistry for over 36 years, and I can tell you, as a clinician, I see much more of it now than I ever did before. And I don't know whether, you know, maybe they just kept them at home back then. I don't think so. It seems like I'm seeing an increase.
I think certainly folks are living longer, and so you're getting a lot of the late stage, the older onset Alzheimer's, which is 85 plus. But what we're also seeing is a lot of folks like my mom who are diagnosed younger onset, which is before age 65, which to me is the scariest thing. People as young as 30.
Ooh, okay. That's all the questions I've got.
Good.
Thank you.
Thank you. Mr. Zillis, and then next Nancy Paris.
Mr. Chairman, committee members, my name is Dave Zillis. I'm a parent advocate for individuals with disabilities, and I am so excited to stand up here today because, number one, we're not facing any cuts, which is great. And number two, I just handed out a bookmark that talks about the great job you all helped me in the last couple of years of adding independent care waivers. And last year you put money in there for 20, the year before 50, and the year before 33. And this is the first year that I don't have to come and ask for more independent care waivers because the governor actually put 25 in there against our waiting list. So I think that's terrific. I also stand before you to talk about what you've already heard is the rate increase. Very positive statement towards the rate increase. The card actually misstates because the rate increase affected not only the Department of Community Health, which handles CCSP, but Department of Community Source, and DHS with CCSP, but in effect it's a 5% increase. And the last increase, as you're probably aware, was in 2009 and it was rescinded. It was a 3% increase, and so these providers, the people that take care of our loved ones on a day-to-day basis, have not had an increase at all. The only thing I would ask is that it did not include any of the people in the independent care waiver. So the only people that are getting this increase are those providers that support CCSP and SOURCE, which are elderly disabled waiver people. So I would ask that you possibly consider looking at, and I don't have the figure I'm trying to get at it, but a possible rate increase to include all the people that support individuals with disabilities. Thank you.
Thank you. Any questions or comments from the committee? Thank you, Dave. Nancy Paris, and then Stan Jones.
Thank you very much. I'm Nancy Paris. I represent the Georgia Center for Oncology Research and Education, Georgia Corps. We're here to request a $225,000 increase from the governor's recommended budget to $500,000, and I want to spend just a moment telling you how important that is, not only to the citizens of Georgia, but to your constituents. We have members of our research network in all of your communities, from Savannah to Augusta to Macon, Thomasville, Columbus, and we've worked for about 10 years to build a very strong public-private partnership that makes it possible for Georgians to receive higher quality, better organized, and more cost-effective cancer care. About 90% of our budget comes from sources other than the tobacco settlement. This year we received $275,000 from the state. That money we're most appreciative of. We really need to go to the $500,000 level to enable us to maintain the clinical trials that we're offering, the information center that we offer. This year we had almost 65,000 Georgians turn to us for information about oncologists, cancer treatment options in the state, and clinical trials. We also work with state departments, public health and community health, to make sure that their programs are appropriately implemented. We distribute breast cancer license tag funds to needy grantees in the state, and with that money we provided mammograms to almost 5,000 women this year, and we've provided education on cancer prevention to over 20,000 professionals and high-risk individuals. Next month at Callaway Gardens, or later this month, we have a seminar on hereditary breast and ovarian cancer and a new screening program to make sure that women can be identified early so that we can get cost-effective treatment to them. So we have a long list of supporters. We maintain very effective organization financially and very low administrative overhead of about 10%. With the 10% of funding that we would receive from the state, we can leverage that ninefold. So we appreciate your consideration very much, and the work that you do in your communities to provide cancer care. And I do have handouts that I could leave.
If
Thank
you
you,
would do
sir.
that, that'd be great.
Okay.
We'll give those out for you.
I'm Stan Jones
Stan
with
Jones.
Nelson
Okay,
Mullins, and we help visiting nurse health systems in metropolitan Atlanta. I wanted to second the comments that the Healthcare Association made through John Howell to support the increase in the rates for the source care managers as well as the other caseworkers there. That's been a hugely successful program, worked out with nursing home facilities and the department. It's very successful. Thank you.
Any questions for Mr. Jones from back? Next, we have two names here together, John Maupin, Morehouse School of Medicine, and Kerry Sumner's Georgia Hospital Association. And then next, Jackie Kemper.
Morning, Mr. Chairman. Thank you, committee, for allowing me to present to you this morning. I share with you this on my last time before this committee. This will be my last year as president of Morehouse School of Medicine. I will retire in June. I would also, as a part of our presentation immediately following me, if you don't mind, have Dr. Valerie Montgomery Rice, our incoming, who's currently our dean and will soon be president in July, that she will join you with join some of my remarks. I'll try to keep mine as brief as possible. What I really want to share is in 1992, I was a part of the team that came to you as we sought to expand our clinical programs and develop our residency programs, having been a 2-year school and then a 4-year, depending on the partnership with Emory. And as we launched our clinical programs and our residencies, all of which for the most part are our primary care residency programs, we sought your help in a model similar to Mercer Medical School, where we used the state operating grant and leveraged that grant with Medicaid supplemental payments. Those supplemental payments have grown over time, and the state operating grant has grown as our programs have grown. We've launched our programs across the primary care area. We've been able to be very successful and very proud, and that's what I hope that Dr. Valerie Montgomery Rice will share with you. In 2006, I came back to Morehouse, having spent 12 years out of the state as president of another school. Came back as president, and in 2006, I shared then with many of you that I was concerned about the longevity and the viability of this matching program, having known that Mercer had moved off of that match and replaced those matching funds with an increase in the state operating grant. The economic environment didn't allow us to tackle that, but today before you I ask that you consider replacing those funds in a multi-year and a phased-in process over the next couple of years, such that we would end up replacing the federal funds and stabilizing the funding and the continued growth of Morehouse School of Medicine and its continued advancement as being a major partner with you in ensuring primary care doctors in our rural and urban communities where needed, serving vulnerable individuals, and the continued advanced expansion of our residency programs. Valerie Montgomery Rice has some facts to share with you about the success of these programs. Val.
Good afternoon, and thank you, Chairman Parrish, for again allowing us to come before you and the committee members. As you know, this is something near and dear to my heart as a Macon night and coming back home. It is always a pleasure to see the interest that the legislators continue to put into caring about the Georgia citizens and how we make a difference in their lives. The investment that Georgia has made in Morehouse School of Medicine has really paid off, I believe, in huge dividends. If you look at the handout I gave you, we believe we are a private school with a public mission. If you look at the first slide there, our students today for the class that graduated in 2013, you see 54 MD graduates. As you know, 20 years ago, that was 20 or 30. But if you go to the next slide, which shows you we are now at 70 students, and what we're most proud of, when those students graduate in 2017, 83% of those students are from Georgia, 76% of them are underrepresented minorities, and we like to say they're academically diverse also, with MCAT scores of 26 and GPAs of 3.42. However, we have less than a 2% attrition rate. All our students graduate, and they graduate on time. What we also are telling you is that we're going to increase our class size, and by the year 2017, the entering class will be 100. That really does begin to make a difference. When you look at the 834 physicians that have graduated from MSM over our time, 66% of them are primary care, and as you see, based on the national average, we're about 35% of our primary care. We double that amount. 66% of our graduates are primary care, and 60% of those MSM graduates have chosen to practice in underserved urban and rural communities. And when you look at that third slide, what matters most to Georgia is when you look at the graduate medical education. This year alone, we graduated 44 residents from our 7 training programs, and 73% of them remained in the state of Georgia. You know, the thing that predicts whether or not someone is going to stay in the state is where they are able to train. So I know you have an interest, Chairman Parrish, in also making sure that we take care of GME. We must expand it here in the state of Georgia. Again, 57% are practicing in primary care, and most importantly, when you look between 1984 and 2013, 67% of our residents have remained in Georgia, and 63% are practicing primary care. If you look in comparison on the next slide, which shows the comparison of Morehouse School of Medicine to all of the other Georgia residency programs, 67% remaining in Georgia, 57% of all those Georgia GMEs go into primary care as compared to 41.9% for other programs. If you look at the 91% graduates from high school, we know that we will get them to practice instead of, is it coming? Am I about to be pulled off the stage? That wasn't for me. I was on a roll too. The important thing, though, is that we know that if we can get those students here to Morehouse School of Medicine, whether they come to medical school or whether they come back and train in their residency training program, we have a 65 to 70% chance they're going to stay here and practice in the state of Georgia. And if you look at this last slide, we are so happy to show that, you know, we got 119 counties that are underserved out of our 100 and how many now? 159 counties. And when we look at this, we have a significant amount of blue dots that continue to go in these underserved areas. And so we're just so excited that we'll continue to be able to bring you information that really gives you factual information on why we are a good return on your investment.
Thank you, Dr. Montgomery Rice. Good afternoon, Mr. Chairman, members of the committee. My name is Carrie Summers. I'm the Vice President of Healthcare Financing for the Georgia Hospital Association. GHA is the statewide hospital trade association serving 170 hospitals across the state. Just to give you a little bit more background on the financing side as it relates to the Morehouse School of Medicine, I know you're aware that there are operating grant funds in the budget currently to the tune of about $11 million. I think what not everybody understands is that there's an additional $21 million or so that those funds draw down through the hospital upper payment limit program, which is really a Medicaid supplemental program. What I'm here to do today is to ask for your favorable consideration together with the Morehouse School of Medicine in replacing those federal funds. Some of the major concern certainly from the Morehouse perspective, is the predictability of those dollars, as well as they are frankly dwindling. And you have in your packet a very brief white paper that gives you some history of the upper payment limit funding that's available to the state that is declining, and from a Morehouse perspective, trying to depend on those dollars over time, particularly to operate a medical school, as you heard Dr. Montgomery Rice talk about. The need for budget predictability and trying to avoid those federal cuts is incredibly important. Certainly GHA supports that request for additional dollars for Morehouse. I don't have to tell you that the fiscal health of Morehouse, not in addition to the other medical schools in the state, are of paramount importance to the industry. It's pretty obvious that those schools train the very clinicians that provide patient care in our facilities. And of course, given the expected increase in the demand for health care, not only because of the aging population, but also because of folks getting more coverage through some of the provisions of the Affordable Care Act, I don't think I could ever overstate the need for the replacement of physicians who are retiring and the need for new ones. And of course, Morehouse is doing a great job in helping to provide that, to meet that demand. I also have to say that the provision of these additional state funds also has a more direct impact to the hospital industry. By providing those additional state dollars, it actually would free up the federal dollars that are currently being matched and provided to Morehouse. And those dollars really are effectively, from a federal perspective, earmarked for hospitals. We would love to see those be redirected to the hospital industry so that we could finance those federal dollars. And ultimately, we believe the use of those funds would be helpful for us to support hospitals who are experiencing net negative impacts related to the hospital provider payment program, as well as being used for some other special purposes that either support the access to specialty health care or for other hospital-based programs like residency training and the promotion of graduate medical education. So on behalf of the 170 members that we serve, I would appreciate your favorable consideration. I'd be happy to try to answer questions.
Much. You, Carrie. Any questions for Carrie from the group?
Thank you so much.
Before we move to the next, Representative Bennett is going to speak with us, but before we do that, I wanted to recognize the Dean of the House, who's over here with us today. He's sitting back there in the middle of the Morehouse group, and I think he's probably trying to get a doctorate degree while he's down here, or something. I'm not sure, but we're glad to have the Dean of the House join us over today, Representative Smythe. Thank you. I knew it was for you to be here, sir. Representative Bennett, and then Ms. Kaffner after that.
Oh, am I next or is she next? Thank you.
Good afternoon, Mr. Chairman and members of the Health Appropriations Subcommittee. Thank you for allowing me the opportunity to come before you today. It's somewhat interesting to be on this side of the podium today. However, I do beg your indulgence. I am Karen Bennett, representative for House District 94, and I rise today to bring to your attention a situation concerning the Children's Intervention Services reimbursement to their providers. Currently, the system provides on a basis of a 2,000-year RVS schedule. We believe that this schedule is outdated. The providers within that system have not received any pay or increase in the past 10 years, while the commissioner did speak to that on yesterday. However, I rise to express our concern. We know that the budget is silent to any increases currently regarding provider increases, and I rise to ask for your consideration. As the governor has stated that the state of Georgia is a great place to live, work, and be for businesses at this time, our children are one of our most vulnerable populations, and we believe that the providers have endured through our hardship in the past 10 years and are here asking for consideration for insertion on an increase in reimbursement. Currently, we are reimbursed at 84% of a 2000-year RVS schedule, and the request is for consideration to increase that to the 2013 RVS schedule at the same percentage. We thank you for the opportunity to stand before you and bring this matter to your attention. As advocates for children with special needs, I speak and stand on behalf of many providers who have continued to provide services. They have contacted me in their interests and asked me to stand on behalf of them. Thank you.
Thank you, Representative Benny. Any questions? Thank you, ma'am. Next, Ms. Jackie Canfor.
Thank you. My name is Jackie Canfor, and I have to tell all of you that I'm just a plain person. I'm a caregiver. My husband has Alzheimer's. I wonder if I'm out of line, but I would like to ask if you are caring or know someone who is caring of an Alzheimer's loved one, whether it be a husband or a wife or a parent or a child or a sibling, would you all raise your hands, please? Wow. Wow. More than I anticipated. But I must say I'm not really surprised because of the message that we got from the earlier speaker. I thought the youngest person was 29. But those of you who are facing this problem of Alzheimer's, I would first like to tell you we would love to have you in our support group at the Presbyterian Shaliford Road Church. We have a wonderful support group, and we do understand the problems that each of us has, as I'm sure many of you do who are in this situation. Now, the reason I am here today is to tell you that my husband has had the good fortune to be put into a daycare center. It's the Weinstein Center. But when the director of that center told me that she was not licensed and there is no daycare center for senior citizens that is licensed in the state of Georgia, I was shocked. I could not believe that we would never send our children to a daycare center if it wasn't licensed. Our pets don't go to places if they're not licensed. But here we are with our loved ones who are helpless. Some of them get confused, some of them wander, some of them don't know how to go to the bathroom or how to feed themselves, some of them are in wheelchairs, and yet the only place that we can put them other than a higher facility, a much more expensive facility, and one that they might not need, is not licensed. And she did tell me that that something has happened so that this has been discussed long before I came here or was in the throes of Alzheimer's, and that for some reason, maybe not you personally, but certainly the subcommittee is aware of the situation that that these places are not licensed. So I'm not bringing up something that's new. What I am doing is pleading with you, begging you to help me, a caregiver. My main concern for my husband is his safety. Then comes his comfort and his caring. Those three things are important to me as his wife. And I am asking you, there is no question in my mind that we have got to have licensed facilities so that our loved ones can go And the people who take them there can be rest assured that they are going to be governed by a higher body who is going to be watching them, as we are certainly going to be watching them. But the higher body is the one that will make the guidelines, will hold them to the T, will at least have a premise to go by. So this is very urgent. And as you heard earlier, our problem is going to increase tenfold in the coming years. And I want to tell you, I thank you for listening to me. I thank you for listening to me. And I pray for your courage if you're going through this. And I pray for your consideration to help us. Thank you.
Thank you, ma'am. Any questions? Thank you very much. Next, Ned Morgans. I'm not sure I'm pronouncing that right. If you'll help me with that. Morgan, excuse me. The way that's, I'm having trouble with the writing here on some of this. Thank you. If you'll just your name and identify yourself when you come up, that'd be great.
Okay. My name is Ned Morgans. I'm with Sarah Care Adult Daycare Centers, also with the Georgia Adult Day Services Association, and have served as the chair for the National Adult Day Services Association. I come as a provider representative, asking that the committee and this legislative body approve the funding for adult day care licensure. The authorization for licensure actually took place about 10 years ago. It's been on the books there, and we've been waiting for that funding to implement. The funding that's required is approximately $300,000. Some of the benefits that that I think we would see, as Jackie so eloquently discussed. In addition, I think the name adult daycare, the service goes by a lot of different things. It means a lot of different things. In some cases, it's a marketing effort. In some ways, it's in other ways, it's a very sophisticated medical service that individuals will provide. Two of the benefits that Georgians will see is that with licensure, it just makes things a lot easier if you are trying to access funding. And so for individuals who have long-term care insurance, the first question that they always ask is, can we see your license? Of course, the answer is no. Most of the time we can, if a center is certified through Medicaid, we can get around that requirement, but not every time. And so there are people that cannot get access to funding that they need. Then also, on a national level, some of the conversations that we've had is that states that don't have licensure currently will have the adult day centers, if they are ever able to access any kind of Medicare funding or for other services that may come down the pike, will have difficulty accessing those services. We think that the $300,000 to implement this program to ensure that the centers are meeting some high standards of care is well worth that money. It's certainly not a whole lot of money in the grand scheme of things, but it will make a big difference for families who want to ensure that their centers are, the people caring for their loved ones are meeting minimum standards, in most cases higher than that, and then also that they can access funding to which they have paid or will be entitled to. Thank you very much.
Thank you, sir. Any questions from the committee? Okay. Thank you. Deborah Furtado, excuse me. And then Helen Sloat will be next.
Mr. Chairman, members of the subcommittee, thank you. My name is Deborah Furtado, and I'm the CEO of Senior Connections. We're a home and community-based nonprofit that provides services such as Meals on Wheels and in-home care. And I got involved with the adult daycare licensure budget issue a couple years ago. I'm here representing part of the council, the Georgia Council on Aging, as well as Leading Age Georgia, as well as the Georgia Women's Policy Institute. A lot of folks, our organization does not provide these services, but having been involved in the team that was looking at this budget issue, I'm determined that I brought some folks here, and I think I need that mini mental test because I didn't know they were sitting in the front row, and I was panicked because I let them off. But I have to say that the research we've done, Georgia is surrounded by states, Tennessee, Alabama, South Carolina, Florida, that all require adult daycare centers to be licensed. That, I think, being someone who is a bulldog, I think that we can't let them do something that we're not doing. It's just embarrassing. Second is the cost is about $300,000, and as I know the chairman knows, we've been talking about this, is that $300,000 is the Department of Community Health would implement this. This would be part of what they currently do, and so this would be dollars for staffing. One option is that my folks back there from the Council on Aging may kill me, but there are some options here. $300,000, when I try to divide that into a $20 billion budget, I can't even figure. It's such a minuscule part of it. My iPad wouldn't even go that low. But the second thing, and the value you would get from that, you'd be collecting fees. So the fees would partially offset this cost. This cost would be for people, would also be doing additional work there in DCH. And so every year we would not be adding the same amount of money. And I know usually when it comes to dollars, if you're running an organization like I am, that's important. So you could implement this in, say, the second half of the fiscal year. Could be January, could cost even less, could give DCH some time to get going. But I still think that it's not a lot of money to ask for. And I have to say that in doing this research, I've learned from my adult daycare partners the value. We provide meals to many of the adult daycare providers out there. I tell my daughter all the time that as I age, I want to be able to go to adult daycare. The alternative, I think, is not good. This also saves a lot of dollars. It's part of that home and community-based process where you're saving, $30,000 to $50,000 a year for someone to live independently. And adult daycare is part of that. So this is just so important. We're asking you to put this in the budget to allow DCH to have those dollars in the budget so that then they can continue to budget for this on a regular basis to put Georgia on the map so we're not a little hole there surrounded by other southern states. And also it creates jobs. It enables people who have folks in adult daycare centers to work. It also creates more jobs for additional adult daycare providers, but the bottom line is I think more of us will need these services, and the fact that they can also get insurance companies to help pay for it if they're licensed is very powerful. So thank you very much for your consideration.
Thank you, and we have a question for you, too. Representative Gardner has a question.
Thank you, Mr. Chairman. Remind me, that several years ago, a bill was passed to create this licensure. What year was it?
It was passed in 2003, and we already have on the books, I should have said that at the beginning, the Adult Daycare Licensure Act is already on the books. We have it. It just has not been implemented. So the rules and everything are already there. In fact, DCH already has all the guidelines. All we need is the money to implement. All we need is $300,000 to make it happen, and then you're not going to have $300,000 happen every year, and you're going to start collecting fees.
Will it eventually pay for itself?
I don't know if it'll eventually. I don't know that answer. I think that as you have more and more, it could, but it'll take quite a few years for that to happen. But I think initially there is that $300,000 investment, but you will be collecting fees and doing inspections. Yes.
Yeah, years ago, Representative Lynn Walker had a bill that I carried in the Senate, and this bill related to respite centers, the churches.
Yes.
And exempted them from the licensure process. Do you support that?
Yes, and I believe this current bill, I think, does that. I think we found, I have to ask Ned this question, that we have found that all of the folks in this coalition working together with Council on Aging, AARP, Leading Age Georgia, the Georgia Women's Policy Institute, that no one has said don't do this. In fact, the Council on Aging adopted this as one of their items, and so and everyone voted on it. So to answer that question, that the churches and all of them are for that. And we provide many meals to churches who provide adult daycare, and they're like, please let us be licensed. It gives us, it makes us authentic, So yes, so I answer your question. I don't know the exact answer to that. I should, and I think we can look at that at the law, but I think there may be an exemption for them.
There was an exemption.
Yeah, and there's also a different fee for depending on your size. Right. So the really large adult daycare providers would obviously pay more than smaller ones.
Can you tell us how many potential licensees there may be?
Yes, sir. There are about, what we know of, at least those we know, about 200 in our state, and so there are probably a lot more smaller, groups. But it's been hard for folks to stay in business, quite frankly. Costs have really gone up for everyone. So I think what we have found is we've actually adult daycare centers some of them have closed. So this could actually help us increase that. But about 200 in Georgia.
Good. Thank you.
Mm-hmm.
Next.
Yes, he can actually answer the question, sir.
The bill what we're looking for right now is just the funding, and the exemption that took place about 2008 when the funding was last passed. That's not being addressed in being asked to be changed at all. It's just funding and implement what's already on the books.
Thank you. Next is Helen Sloat, and then Scott Maxwell.
Good afternoon, Mr. Chairman, members of the committee. I'm Helen Sloat. I'm with Nelson Mullins, but today I'm here on behalf of Easter Seals, and I wanted to talk with you a little bit about some children that previously were covered under the Katie Beckett program. Many of you will remember in 2006, you all placed in the budget that year $7.6 million to help those children when the criteria was changed for them to actually access services. And through that program, that $7.6 million, the Atlanta Community Foundation actually managed to oversee the voucher program that first year. And when they did that, they held focus groups across the state to determine what families were thinking about in terms of how should this go forward and how this $7.6 million could be used. So fast forward, Easter Seals responded to a bid request that was sent out by the foundation. They won the bid. They were statewide. They have since managed the program, and they call it Champions for Children. And now Champions for Children has been serving children across the state, and as of December of this year, they had 325 children enrolled, and they were actually serving children and families in 65 counties, but they are statewide. I want to stress that. And they can handle children in any of the counties around the state. A couple of things that you need to know, I guess. These are medically fragile kids. They have to be denied by the Katie Beckett program in order to be eligible for Champions for Children. 30% of the children that the Champions program actually helps are children with autism spectrum disorder. So I think that's a really interesting fact. And they actually will, until June of 2013, paid each family up to $2,600 per year to help with services such as therapy costs and things of that nature. They've also helped children that have metabolic food disorders, children that need hearing aids. There's just a host of things that these monies will go towards helping these families. In June of 2013, they had to lower the amount to $2,000 per family in order to make the dollars stretch. So we're here today to ask for $500,000 to continue the program. Easter Seals absorbs all administrative cost to the program. All the monies that they've had in the actual grant that was initially established have gone towards services. I'm happy to try to answer some questions, and we would greatly appreciate your support of this request.
Thank you. And we do have a question. Representative Gardner.
Well, it sounds like a wonderful public-private partnership to me. So the children that we are told earlier are being identified at the Marcus Autism Center without possibilities for treatment could then take advantage of this money because they're not severe enough to be eligible for Katie Beckett?
Yes, ma'am. They could get up to $2,000 per year to help with the services, therapy services, for instance, that Marcus might have.
Thank you.
Thank you.
Let's see. Next, we're going to hear from Scott Maxwell, and then looks like Betsy and James Stiles, maybe. Scott.
Mr. Chairman, I'm Scott Maxwell, and it's my privilege today to rise on behalf of the Georgia Public Health Association. yesterday, Commissioner Brenda Fitzgerald testified about the Department of Public Health budget, and some questions came up about the Hold Harmless program. So I just wanted to take a minute to bring you up to speed and give you a little history on that, and for anyone that sometimes finds it confusing. But several years ago, the Department of Public Health created a new formula for distribution of general grant and aid dollars to county public health departments. And that new formula helped some counties and hurt some counties. And some counties got hurt to an extreme. Fulton, Chatham were more than $1 million each in losses based on that. Chatham's county losses were 45% of their budget. The department wisely did some things to mitigate that damage, and frankly, some counties got as much as $2 million more than they were getting. So instead of all that happening at one time, a huge cut or even a huge infusion, the formula was set to phase in over a 7-year period. And so what has happened is each year the money has not been in the governor's recommendation, but this committee, in its considerable wisdom and under the dynamic leadership of its chairman, has put the money in the budget here in this committee. And those funds have been used to help the public heart by simply putting a floor in, so the counties that would lose under the new formula are able to keep the money they had. And again, it's in a phased in. We're in this budget we're discussing today would be the 4th budget it's been put on. Your committee has done it 3 years previously. The money again goes to the grant and aids to local county health departments. The last figure I saw, we're short more than 700 public health nurses in the state. To further cut some of these counties that desperately need the money to run programs that keeps Georgia healthy is very important to the Georgia Public Health Association. And again, I just wanted to make sure everybody understood that. The Public Health Association appreciates you putting the money in past years. The Senate has always agreed to keep it in, and we would urge you to do the same again, and I'd be delighted to take any questions.
Thank you, Scott. It's a team effort. Any questions from the committee? Yeah, okay. Go ahead, Representative Holmes.
Yeah, sorry. When you receive this money again, assuming you will, is this going to help us get another dental director?
I think about that. How about I hope so?
Thank you. Next, Betsy and James. Do you have a question over here? Somebody else? Okay. Betsy and James Stiles, and then John Keys be next.
Thank you for allowing us to present our concerns. One, we hope you will support the allocation for the adult daycare licensing, and also the funding for the Alzheimer's registration for the state. It's extremely important to know how many people are actually in the position that we are. We found out we could come at 1 o'clock well, actually, first thing this morning. And so I pulled some information that both of us have spoken before. So if it helps you to know that as a caregiver and as someone who is suffering with Alzheimer's, I hope this will be helpful to you. My husband is 86 years old. He was diagnosed 12 years ago with early stage Alzheimer's. This shocked our family, a daughter and a son, as this diagnosis was traumatic since it was fatal. It is for any family, but ours are full of professionals that have dealt with other families whose loved one had Alzheimer's. My husband is a retired Methodist minister. He has been a minister for over 60 years and a chaplain in the United States Air Force for 22. He is a 100% disabled veteran. I have been a minister's wife for 54 years and was ordained a deacon in the United Methodist Church and have retired to take care of my husband. Our daughter is an RN. Not only is she medically knowledgeable about Alzheimer's, she is a liability specialist that deals with Alzheimer's families and insurance. My husband is on a maximum dosage of one of the only 2 medications that can help to delay the progression of this terminal disease. My greatest fear is when that medication is no longer effective and that I know there is no other medicines available. To learn the lack of additional medications is due to the lack of funding and is beyond belief in a country known for its medical research. My husband has volunteered for every research project that Emory Healthcare and the VA has had to help other families who will have to deal with this dreaded disease. He has even signed up to have his brain autopsied after death. He makes sure that my daughter and I carry that blue card. For his protection from wandering, which has happened rarely, but we got lost in Phipps Plaza one time, all the outside doors in our house have had deadbolt locks and a security system on each outside door that notifies me if he has opened it, day or night. We both wear medical alert bracelets that we are registered nationally should that wandering or should I be involved where I could not get back to him. That medical alert would tell them that. My role as a caregiver has been a journey I would rather not be on, but I am. From the taking the car keys away, to taking over the finances, to finding ways to stimulate the use of his brain, to go on and on. I have learned that stress is a killer for the caregiver. 65% of elderly caregivers caring for an elderly relative do not survive due to stress. I have had to learn how, it's only short more, not going any further, how to relieve that stress through attending an Alzheimer's support group at Shalford Presbyterian, like Jackie. And we hope that there are many, many more of those because I learned a whole lot. To taking Tai Chi, to cuddling with our little rescue dog and getting my face licked. Any help from the state of Georgia in caring for my Alzheimer's husband will make our lives and the lives of thousands of other caregivers a relief that we will be kept safe. Please help us. Any questions?
Thank you, ma'am. Any questions?
Wait, oh, sorry. Do you want to say anything? You can. Would you like to say something?
I want something done as fast as it can to wipe out this bug. My years in the Air Force were great. My ministry there was fulfilling. And then I came home, was signed to different churches. One, I'm a Methodist, and I would go to short times that a pastor had left or something. And I finally left because of that. I was afraid. I knew this was coming on, and I didn't want to disturb people because of that. Thank you for what you can do, and we hope that you will do to help those that are like myself and others that are going deeper each day into this, and we'll see it later. Now I know, as Betsy said, that the amount of time before I was aware of what it was. I just knew I began to not be able to remember. But as a student in the college and in the university, tell me something one time, and that's all I would need to know. But now, I've reached the point that I might ask you to do something that you had said that I would forget before I could get to my seat. My wife has to look after me very closely, and my daughter. I had hoped to have many years to do things that I wanted to do and to be able to continue as a Methodist minister. But that's it.
Okay,
thank you. God bless you.
Reverend
God
Simon.
bless America and all of our legislators and our governors. Thank you.
Reverend Stiles, Ms. Stiles, thank you for taking the time to be with us
Were there
today.
any questions?
Any questions? No, ma'am.
I have only one copy of this. Would you like to have it?
We'll take it, and we'll make sure that the committee gets copies of that. Yes, ma'am. Thank you. John Keys.
Thank you, Mr. Chairman, members of the subcommittee. I'm John Keys, and I am representing today, speaking on behalf of the Georgia State Retirees Association. I'm in the enviable position of having shown up at a meeting a couple months ago, and lo and behold, I was put on the board. But I wanted to follow up, and our members wanted to follow up on yesterday's presentation by the Department of Community Health to let you know of our concerns, our members' concerns, and to suggest a possible option for y'all to consider to try to anticipate issues in the future perhaps a little better than they have been in the past. Our members are both active and retired members under age 65 and over age 65. And there are about 62,000 retirees from throughout Georgia, and that number excludes teachers. We know you've been hearing from a lot of our members and from the teachers, all kinds of retirees and active employees as well. We have a number of concerns. We're continually seeing premiums increase and our deductibles and out-of-pocket increase as well. At the same time, keep in mind, and I know you all know this, but it never hurts to hear it again, state employees have not received any adjustment in compensation or their retirement benefit since at least 2008. Thus, our premium increases and inflation have decreased our purchasing base. Our members are most concerned about not having a choice that gives us adequate medical care that we can afford because of these deductibles. Our members are upset about the increased drug co-pays because of formulary changes. And our members are upset about the limited network of doctors and hospitals and not being allowed to visit standalone laboratories in some parts of our state. We would offer you three thoughts today. First of all, we would ask you to sponsor legislation and pass legislation that would require the Department of Community Health to hold meetings with current and retired employees, teachers, regular state employees, everyone, and active and retired employees as well, as an advisory committee to the department, and accept input into planned changes so that we don't get hit with an after the fact, here it is, and then we have 30 meetings around the state and we show up rather upset. We think it's better to catch things on the front end. We would offer up that as one means of addressing our concerns, put something on the books to require the department to do this. Second point, we would also like for the Department of Community Health to restore the state health benefits plan close to what other large employers are offering their workforce. It's our understanding that Price Waterhouse has reported that most large employers are providing medical plans that pay 80 to 90% of medical plan costs. By contrast, it would appear, based on DCH data, that the state health benefits plan gold level is designed to pay only 77% of medical cost, and the bronze level to pay only 63%. Thirdly, and lastly, we really don't want to see state and local school system personnel to be considered employees of last resort. We deserve better than this. You all deserve better than this, and the state of Georgia deserves better than to have this entire class of workers considered to be a last resort employer or employee of last resort employers. We thank you for your time and consideration. We'd be glad to follow up with any answers to or comments that you might have.
Thank you. Any
Thank
questions
you,
or comments? Thank you.
Thank you.
Question? Okay, here we go.
Thank you, Mr. Chairman. Would you just clarify that that third point that you said?
About the employer of last resort? Mm-hmm. If we keep pricing our benefits package at far less and eroding through not adjusting employees' compensation or increasing funds going into the retirement plans and so forth, their purchasing power is going to erode to the point of not being competitive with private sector employers who are offering better service in the way of cost sharing. So we're going to be driving folks out of the public sector, teaching and regular employees, to the private sector. That's what we're trying to say.
Okay.
Hope I accomplished that. Thank you. Thank you very much.
That exhausts the list that I had, and out of respect to you all that are here, is there anyone who wanted to be heard that did not sign up, or have we heard from everybody who signed up and wanted to be heard?
Mr. Chairman, I just have some information to pass out.
We'll be glad to take that, sure. Anybody else? Well, let me thank the committee members for their attendance. Thank you all for your interest. We appreciate you being here. Thank you very much. We'll adjourn.